Longevity medicine is this new thing. Everybody's obsessed with it, which is we spent a long time historically talking about lifespan and, we want to live longer. And then I was like, okay, fine. And it used to come to my mind quite a lot years ago, which is, what is the point of me increasing my lifespan to 90 and then spending 30 years horrifically ill and having a poor quality of life? So when this whole notion of Healthspan came in, which is the longest version of, staying alive, the longest, healthiest life, that makes more sense.
Welcome back to Beyond the Pills, where we explore ancient wisdom meets modern science for true healing. I'm your host, Josh Rimany, pharmacist turned healer. And today, I've been waiting for these kind of conversations to come through, so I'm super excited. Our guest today is Dr. Zak Zafrani, and we're going to talk about something that I believe, and I know he believes, is one of the most misunderstood and undertreated conditions in men's health, which is testosterone, whether we call it deficiency. And we're going to talk about the differences between deficiency and restoration and all these fun things that we both uncovered in our own journeys, and get to the real holistic story behind it. Dr. Zak is a men's health lead specializing in hormonal and metabolic health and the intertwine between the two, and the recipient of the 2025 Emerging Scholars Award for the Androgen Society. His work sits at the intersection of endocrinology and overall wellness, in a place where, frankly, Beyond the Pills was literally built to live in. So what I love about what Zak brings to this is it's not just a number on a lab. It's about the whole man. And that's exactly why we brought him in this conversation we're about to have. I'm really honored to have you. Welcome, Zak, to Beyond the Pills.
Thank you, Josh. It's a pleasure to be here. Thanks for inviting me.
I loved it. I love the synchronicities. We just literally launched my biorhythm method with testosterone and looking at it from a place of restoring, not replacing, and what's happening in the world of TRT. So I always start, and I love to start with like the origin stories. Take me back to the beginning around what pulled you into men's health, specifically into hormones. And was it a moment, a patient, a personal experience, or all of the above?
It was probably a few different things. My background and love for this initially came from my background in sports. So I went through a phase during medical school. So up until 2018, I used to compete in strongman and powerlifting competitions in the amateur scene in the UK. So I was in and around people utilizing anabolic steroids. So my first kind of awareness of things was compounded drugs that we were seeing people take. And from my perspective, I never delved into that world. And the reason was because I was too aware of the damage from my medical background. But it was interesting to see the reasons why people used it and then the problems they faced following retirement and issues that they dealt with following that. So it was something that was in the background of my mind for a while. At that point, I was trained to be a surgeon. I then had like a change in direction, and I went down the primary care route. So it's like family physician in the States. So we call them general practitioners in the UK. So I went into GP training. That allowed me to kind of focus more on having a more general view of things, but also being able to tailor my time into the things I want to do. So I wanted to do a bit of sports medicine, so I focused on that. And then as I started working within the community, I started to see issues around hormone deficiency in men, and specific things were coming up quite blatantly, which were things that flagged to me. Men coming in mentioning sexual dysfunction regularly, being told by their doctors that they were depressed and being given antidepressants. And, 3 years down the line on sertraline, venlafaxine, all these drugs and nothing. They would say to me, I was completely fine 5 years ago. And lo and behold, you do a simple blood test, which doesn't tend to be done much in the National Health Service in the UK. You'd find that they had a testosterone deficiency. The difficulty really came for me when it looked at how you manage these patients. So the protocol within the National Health Service is really difficult to treat men in the
Talk
UK.
about that. Tell people a little bit about what you see in the UK, because and I want to talk about the United States too, because the TRT is very different here, and it's but at the same time, I believe, and we can talk through it because I think you and I align, is we all both believe that the solutions are the same, but we need to figure out how we get there, right? But you were telling me stories that I was like, oh my gosh, I have way less barriers than you do. Tell people a little bit about like, what is the hormonal deficiency TRT thing in the UK? Because you guys have this. I want to hear it because people need to hear it.
We're governed by the British Society of Sexual Medicine, so it's called the BSSM. The criteria set in the UK to actually get a diagnosis of deficiency is you need 2 readings under 12 nanomoles per liter, which is the equivalent of like 350 in
US male terms.
Basically 350-ish. And then if you're diabetic, you can go up to the 14 mark, which is around the 400 mark. So anyone with 2 readings below one of those 2 counts as a deficiency and can be eligible for testosterone replacement. Now, that is the beautiful guidelines set by the British Society. The issue is in the UK, to get diagnosis is pretty hard. You've got to fall below. So rather than 12, you're looking at below 8 or 7, which is a lot less than what you would look at. And most of these men who would be classed as deficient, they go to the National Health Service general practice, their GP, and they'll be told either turned away, or they'll be told to go away and come back in a few years, or be told everything's fine. General practitioners in the public sector cannot prescribe testosterone. In the private sector, they can. So this is completely different. This is why in the UK now there is a huge draw in the private sector for testosterone replacement, and with good kind of reasoning. So we take the National Health Service and push that aside. This is why not many men go towards the NHS. If you even look at the private sector, we have very strict barriers. So if you're above that 12 mark, 340, you cannot be prescribed it. If you are prescribed it, it's against guidelines. You can be struck off the register as a practicing doctor. So this is where it's slightly harder for patients who fall in this gray area between the 12 and 15 mark, where, I see it and I see patients with all the symptoms, and with trials, they actually recover. So you've got to be very careful with how you treat these patients. So we do have a lot of barriers within the UK on how to treat testosterone deficiency, but the awareness is increasing. Men are aware of the symptoms. They hear it. They see podcasts online. They see, celebrities who talk about it a bit more openly, not so much as a doping method, but more so as a means of revitalizing a person and almost, just improving their quality of life, which is what we all want. We want longevity. We want to live the longest, healthiest, happiest life. That's what we all want.
Okay, I'm gonna yes, and I want to talk to you about this because this is a podcast. I'm not gonna say, we can say whatever we want, but I want to get your real feelings and thoughts on this, because I've been on this deep dive. It's been about a 2-year process for me to really get to this place of. So my direct question is to you, and this is theory. This is like, in a perfect world, why are we waiting to deficient when we should be looking to restore to optimal? There's a gap. So I'm seeing it's kind of like in cortisol, right? You're not treating Addison's or Cushing's. Those are the top, but everywhere in between, men that are in their 30s, 40s, and 50s that aren't quite at the bottom are in this space of actually, can we restore you to levels where you were vital? So I want to treat men, and this is what we get. So we have a little flexibility here, like in functional medicine and hormone doctors all over this country. There's a much looser way to do this, but in a concentrated, meaningful way. What I'm trying to say is, especially with the nano emulsions and the things we're doing, is could we, as we grow, like as we get older, we start going lower and lower, but instead of waiting until everything drops out, it's kind of like, we'll talk about the metabolic side. Like, why wait till someone is completely in type 2 diabetes before we actually looked at them, right? So I'm looking at this from a hormonal perspective of, why not restore back rather than replace when it's gone? I want your theory on that.
My theory is, I think, so again, my thinking on this comes from the boundaries that are set with where I practice. So this is the issue that
100%. I want to know that, and I want to know,
in my opinion,
in an alternate universe, if you were to be wherever you wanted, do whatever you wanted, what would be your ideal, knowing what you know now?
Knowing what I know now, I think a lot of men who fall outside of strict guidelines, because I'll be honest with you, the UK guidelines are a bit laxer than some of the other guidelines. So the United States guidelines, European countries have different guidelines. If you stuck to that, a lot of the patients that I see in the UK wouldn't meet that criteria. And I have so many stories of men who are treated at the, let's say, the 400 mark, which we can still treat if they're pre-diabetic, etc. These men have life-changing experiences. They have partners who are surprised at how different their husbands become, and all these success stories that come of it. And then I ask myself the question, as clinicians, what do we need to do? We basically need to look at the patient holistically, symptoms plus numbers. We don't treat either. Right. It's not one or the other. It's both. You look at the lifestyle, and then if optimization comes under the predetermined knowledge that there are risks associated with, for example, long-term effects on fertility and exogenous testosterone shutting down internal production, you have autonomy. If you make that decision, fantastic, as long as you're aware of that. The issue that sometimes comes with this from a clinical perspective, and you get a lot of fight back from doctors, is that can you justify turning off someone's testosterone production without guaranteeing that it can be revitalized later on by using exogenous testosterone? And that's why TRT has a different, TRT gets a different gets looked at in a different light to, for example, female hormone replacement. It's completely different. And even the UK, HRT is thrown at everybody. Any woman that wants HRT can have it. It doesn't work the same for men. And I believe that we're still behind you guys. I will say that. I mean, we don't have the flexibility at all, but maybe in the next 10 years, as information grows around testosterone replacement and people understand it, it will become more widespread. But yeah, I think in terms of optimization, I have seen and heard of plenty of people who have benefited from it. So I can't completely go against it, though my strict, rigid guidelines would say you can't. So that's generally.
We want to protect that piece, right? We're all clinicians. We all have to go it's still a class 3 controlled substance here in the United States, which puts another barrier of things in there. And things are loosening, that's going to get debadged soon and things of that nature. I want to talk to you about the suppression and fertility. I'm going to park it because of the things we're working on. But you said something really profound, and I want this to resonate with the listeners, female and male. You said when you get some of your testimonials and your case studies have shown a pronounced transformation in how they feel in their lives. Talk to people about the benefits of when someone is optimized, because it's beyond the anabolic, like you said. We've talked about it a couple of times on this podcast, but I really want to hone in on why I believe there's a very big amount of men in our country, but in everywhere, that are underserved because it's not really brought to light. But what does testosterone, when in the right ways optimized, whether that's naturally or exogenously, like you said, what are the effects? People need to know. It's like everyone just thinks testosterone, male bulk. That's it, right? It's way beyond that.
It's so different to that. A lot of people question about I'm going to put on excessive amounts of muscle, I'm going to look like the Hulk. It doesn't work like that. I mean, you'd have to, if you know what bodybuilders take, you'd know that that's not going to happen with the drugs that doctors and clinicians prescribe you. So testimonial wise, there's so many of them. The general things that we see as a reversal. So what symptoms reverse? The general ones are sexual dysfunction, which is the defining criteria that we use in the UK,
Right.
and
Adam
which is
score is what we're using.
exactly. So you would have improvement in libido, improvement in erectile function. So the ED would disappear or resolve. Improvement in morning erections. Now that's just from a Adam score. We look at it to get the figures. Let's talk about how it impacts a patient. Energy improvement. So men usually come and say, the first thing they say is, usually what they say is, I felt like I just had to accept that I was getting this age. And these are men in their 30s and 40s. They're just like, I just assumed this is what aging is. And I'm 36 and I feel pretty healthy. And I was saying to them, like, well, you were tired, you were sleeping the day, you couldn't get through a whole day, you were agitated, irritable. And then you reverse it and they realize that it wasn't being in your late 30s. This is just a hormone deficiency. So it changes their energy levels, it changes their mindset. So concentration levels improve, motivation comes back. And then with motivation improvements come the benefits of being able to be motivated to train, being motivated to improve your financial situation, your job prospects. I've had so many men who were running businesses that were almost like failing and etc. just because they didn't have the motivation. They come back and they're like, I'm thriving. My business is fantastic. I've secured this, I've secured that. And they tell me all these stories. I think this is fantastic. And that's what I live for. I do this job for that reason, which is to hear them and hear their partners, for example, who will come and say, oh my God, I can't believe, I just assumed I'd lost this version of this person. And now he's back and I feel like I've lost 5-10 years and he could have been on this earlier. And usually men always say this to me, I wish I'd explored this earlier on. And that's the thing.
The case for almost everything, right? I wish I had done this earlier. And I get it. Like that's the essence of what we're talking about as men. Men like to create. Men like to be like, we literally want to create things. We want to have that, exuberance, the energy to do that. And that's why I say this underserved marketplace is in that essence, right? When I just say, sometimes they say I got my life back, but sometimes it's just like I got my edge back.
Yeah.
Right. I lost my edge. I thought this was the product of aging and getting older. And I just sort of accepted this way and manner who I am, even though it wasn't my complete whole self. Right.
Yeah.
And I talked, there was another podcast we did on this, was it completely changed this guy's life around. And we talking about that part, you said mindset, but there's a mood component to testosterone directly, not indirectly, like directly. And because hormones are we only need small amounts to do a lot of things in our biological processes, right?
Yeah, correct.
And you said it, like, there's nothing wrong with women going through this and getting rebalanced and from the perimenopausal, menopausal state. This is there's a lot of stories for this, right? Holy moly. I wouldn't have thought, but it's the same thing for men.
It's true.
In a different light, right? We're not trying to say one or the other. It's just, that's why this space can really use the attention. So thank you for bringing it to light.
Yeah, I think it's important because I think the more people are aware of it, and I always say to, I not just patients, but people who I know personally, if you question it, just go get a blood test. I always say this to them, nothing bad will happen by you getting your labs done. Get a blood test, get your testosterone level done, check all these things out. At best, you will find nothing and you will just know where your baseline is. Because one of the things that comes up quite a lot is I'll get 40-year-olds, for example, and then they'll ask me the question, well, how do I know what my test levels were when I was 20 and 30? And I was like, you won't unless you have them tested. And this is where you're getting more young guys now who are just saying, I actually feel fine. I just want to know what my baseline is. Yes. Because then when I'm 40, I know what to compare it to, rather than starting blind to the process, and that's the
Well,
difficulty.
I'm glad you brought this up because this has been on my mind, and I'm glad that we have a peer-to-peer conversation here because what we're accomplishing with this new programming rooted around a new dose delivery system that allows for this little blips versus a whole lot of testosterone. But that was my thought, is like, what if we could test when we were vital in our 20s and seeing exactly what our framework was, whether it's mitochondria, whether it's all the things, like doing these baselines of vitality so we can personalize somebody's restoration back to where they were biologically in order, but then keep the wisdom of their age, right?
Exactly.
50-year-old is very wise, but he doesn't feel like he felt in his 20s and 30s. So the goal for me, I believe, in the next 10 years, that's where we're going to be. We're going to say, all right, how do we personalize you from getting you back into biological, vibrant health from your personal experience now? Like, how cool is that?
It's amazing. And this is why this conversation is really interesting, because this space is ever evolving. In a year's time, the things me and you will talk about will be completely different to what we're talking about now. And things are changing so quickly. And this is why I like being in this space, because my focus is more on men's health. But longevity medicine is this new thing. Everybody's obsessed with it, which is, we spent a long time historically talking about lifespan. And, we want to live longer. And then I was like, okay, fine. And it used to come to my mind quite a lot years ago, which is, what is the point of me increasing my lifespan to 90 and then spending 30 years horrifically ill and having a poor quality of life? So when this whole notion of lifespan came in, Healthspan came in, which is the longest version of, staying alive, the longest, healthiest life, that makes more sense. I want to live into my 90s and maybe 100, but I want to be healthy up as long as I can, so I don't have to be frail, rely on people, have my kind of cognition to similar extent as what it is now. I can function. And then the other things, which is people forget, which is that you mentioned about mood. One of the things that was really interesting is people think hormone replacement like testosterone will send you angry and agitated, and people will become, really triggered. And it's not true. I actually had a patient whose wife was telling me that her husband became more loving. She was like, I was surprised. She was like, he went on to TRT, and the first time in 8-9 years, she was like, he was so loving to our kids. He's just mellowed completely, feels settled in himself. And that was interesting, because I say this to patients. It's not going to turn you agitated and angry. It's just because of the bad rep that bodybuilders who abuse anabolics kind of put forward with certain compounds.
Less is more, and it's like returning. That's why I call this the biorhythm method, because we're putting people back into their own rhythm by putting it, which is why I love this conversation around how can we map our vitality and extend the vitality. Like you said, my goal for years and years has been, how do I myself in my own health journey and also others is live at the highest level for as long as possible. And then when I'm ready to go, boom, I'm off the planet, right? That's it. Live vitally forever until you're done. And so it's not about that span of existence of time. It's the quality of time we have at the same time. We want to extend it as long as we can, but we want it to be vital. So I love that. And I feel like that's where we're going towards when we look at longevity, when we look at the new age of medicine, where we have, like you said, we're already moving light years ahead day after day, not just with AI, but just our levels of understanding of how it all intertwines. I want to talk about the holistic part of that and the blending of that with metabolic health. But let's talk about one thing is there's lots of hosts of causes of testosterone going down, right?
Yep.
And the reverse of that is, well, how can we improve these hormonal levels naturally? Because a lot of people don't, and this is where you and I also play, is like, if they're not criteria for the replacement, then how do we help the body revert, like metabolic dysfunction? All those things are some of the root causes of why that goes down. But I have friends that we are in the same circles with, they're improving their testosterone with age because they're doing the right things with lifestyle. So I want you to get your experience and from what you've taken with that, because guy comes into your clinic in the UK, he's not a candidate. Where do we go with him to teach him that there's things they can do? Because we can all empower ourselves, right?
Of course, yeah. And that when we looked, my professors always used to say to me in medical school, which was that you always try lifestyle and conservative management first before medical therapy. It's not the first step in treatment. And if you have someone who doesn't embody the correct tenets of lifestyle for improving testosterone and you just put them onto TRT, it's not the best way to do it. Even as someone who is truly deficient, you still want them to improve other aspects of their life to improve their testosterone internally. And
well, thank you, because we're beyond the pills here. Like,
exactly.
Beyond, I always do this. Like, you could give someone 15 supplements, but if they're not in the right mindset and they're not in the right lifestyle, it won't work. So same applies, right? This is not a pill for the ill.
It's not. And you do get
for the ill.
You do get men who there are some men who turn up and they do not want testosterone replacement, and then there are some men who are very gung ho. They'll just be jumping at the chance to be injecting testosterone, and there's challenges with both of them. The one on one side, which is trying to explain to the one who is deficient that they need it, and the other side is the one who isn't deficient, who just needs to focus on his lifestyle. And specifics of lifestyle are the common things I see. Stress management. So stress is, they're all saying stress kills a lot of things. It ruins the complete hormonal makeup of your body. So this is why chronic stress is terrible. So I always say to patients, you need to find methods of optimizing stress, whatever that would be. I wish there was a beautiful switch you could just turn off your stress and live your life. It doesn't work like that. So you have to find things and implement things in your day that help improve that. The second thing that is probably one of the most common things I see is sleep issues. Patients not sleeping properly or utilizing caffeinated products late, and then their depth of sleep is poor. They don't monitor their sleep. I think we spoke about this. I'm really big on, I like monitoring. I love metrics. So if I could wear, I've got a ring that tracks my sleep and things. Same.
Well, we're a big proponent of Aura here.
Yeah, same. So I think it's been the best thing I've ever been involved in, because it allows me to monitor my sleep and also make changes to my day and see the impact. And it's not a placebo 100%. Effect. So sleep issues, stress, diet and exercise. Patients who don't do any resistance training aren't motivated to do anything. They're going to have lower testosterone levels. And then things metabolically that cause issues. We know that diabetes, prediabetes is on the rise generally worldwide. We know also that from data that's coming out of a current trial, that there's higher figures, but let's say 1 in 4 pre-diabetic and diabetic men are likely to be testosterone deficient. So then that begs the question, if the diabetic and pre-diabetic rate is increasing and obesity is increasing, then testosterone deficiency will increase because of that. And this is where there is this intersection which really interests me, which is diabetes and obesity and pre-diabetes is reversible in my mind.
100%.
So then testosterone deficiency for those subset of metabolically impacted or impaired patients is reversible. And if we can reverse testosterone deficiency, it's the better option. And then obviously within that subcategory, there are some men who don't respond, and that's fine. And they're the ones who actually improve fantastically with testosterone replacement as well. So there's a few steps for metabolically impaired patients, which is where I'm interested.
I want to do a little deep dive on that because you've done a ton of research on GLP-1 receptor agonists, and also, just that whole metabolic component to testosterone and the interweaving. But give us a little bit of science on why sleep helps testosterone levels, because when does a man make testosterone?
Yeah.
And how does it get produced if we don't sleep well? It's another, look, we say this, and I hope people get it by now. Like the number one, the number two, and the number three longevity tool is sleep. Sleep. Like if we get restorative sleep, which is why we have to do this. I was talking about this in my own head the other day, is talking about how REM cycles in sleep are so restorative for certain components. And then I was thinking about how many people take sedative hypnotics that suppress REM sleep, which then suppresses everything else on restorative balance. But here, like Leydig cells, they wake up, they make testosterone when you're sleeping. So again, if we don't sleep, guys, and if there are any entrepreneurs in here that have had this mindset like I had 10 years ago, which was I'll sleep when I'm dead, like, yes, you will. You're going to get to there faster.
That used to be my go-to saying to my wife, and she laughs now because she'll say, she's like, you sleep well.
First mountain of life is like, I'm so vital, I don't need to sleep. And then we forget that sleep is actually super critical.
Sleep is restorative. It's all to do with this issue with cortisol. You need to sleep at certain times. Restorative sleep is best. There are some people who will tell me that they can sleep at 1 o'clock and sleep till 8 a.m. and they're still getting 7 hours. And my answer to them is that that's still incorrect. The best and most, you need to be asleep before midnight. There's plenty of research that's been done on this, so you can get your correct REM cycles in.
Circadian rhythm. We should not.
You shouldn't be
not, like, don't fight nature. That's what I keep going to. Biorhythm means go with nature. We have a circadian rhythm in our bodies for a reason. When it's dark, sleep. When it's light, wake up.
Yeah, and cortisol spikes and drops at certain times. If you're awake, your cortisol won't drop by midnight. So then you're going to have persistently high cortisol. That leads to your melatonin not spiking at the right time, which will then set off the whole offset of your rhythm completely. So you won't sleep properly. You won't get into deep sleep properly. Then we talk about Leydig cell function. You won't produce enough testosterone to spike in the morning, because testosterone spikes first thing in the morning. That is why men who are healthy and well should get morning erections, because when the testosterone
levels... It's a marker for testosterone. It's a marker for vitality, which is why it's the first question you ask, right? It's like, it's not erectile dysfunction. It's like, do you have morning erections? Yes or no?
And there are some men will say, oh, I just thought I was older, so they just stop. And my answer is usually, no, I shouldn't do, because there's actually some work being done on that being one of the most important signs of male ill health. And it's true, because
endothelial dysfunction, right? Exactly. If we're talking about nitric oxide support, if anyone's questioning this is how Viagra became a drug for ED. It's because it works on nitric oxide pathways. So the opposite is true. This is why we put nitric oxide support supplementation and food at the forefront to help these conditions, and also support the vitality piece.
100%. I think these things are so important that I don't think people look into it. I think one of the problems that we do have, men generally are generally pretty stoic. So I run into a lot of men who are just, I'll walk it off, they say in the UK, I'll just walk it off.
Well, that's what we need to talk about, because I want you to bring this to head, is most men do not go to the doctor when they know something's wrong.
Correct. Yeah.
Right?
We know that.
They're going to toughen up. They're going to do their male thing, and it can be the place where it's much more difficult, or even too late sometimes, because they didn't get it when all they had to do was, we talked about this a couple weeks ago, same thing, right? the metabolic dysfunction piece, like
Yeah.
this is all, your body's a warning sign. We should listen to it, but then our mind needs to act on it so we can become vital again,
Correct. And there are reversible aspects to every disease pathway. And this is something that needs to be looked at. We know this, within clinical care, majority, I'm not going to say all men, but majority of men tend to hold off and they will ignore symptoms until it's quite significant. And one of the things that I think is really important is to battle that, is to educate the masses, to inform people of what symptoms to look out for. So there have been so many, not advertisements, but there's been like public health promotions from different countries about cardiovascular health, stroke, all these things to look out for. Men's health is going to go into that realm soon, where I think it's really important that generally men find out that this is something that's a lot more common than people think. And if it is more common, there's reasoning for it. And the first thing is it reversible? Is it not? If it's reversible, fix it. If it's not reversible, then fix it through medication. And that's where people like us come into it, which is we assist in that process.
Well, and I keep getting to this, and I love that we are attracting these kind of practitioners and people in the, let's call them the healing arts, because when you say reverse, to me, I say we've healed. We've done the job. The body's done it. Is lifestyle first, right? Lifestyle first. More. We've been sort of programmed into, especially in the United States, we should be taking a lot more ownership to the pill for the ill philosophy, because 80% of it's predominantly here. From that perspective, is we can do a lot of work in lifestyle, and it's medicine. It is truly medicine. And this is what we had before we had medications. We treated everything with lifestyle, with food, with exercise, movement, community, relationships, dealing with our stress, getting out in nature. This is like going back into these things as frontline approaches. And then if we can't get there, then medication.
Yeah.
So it's just another same theory. This lens still applies to men's health. And I do thank you, because just us talking about this, bringing light and awareness is what, so let's talk, because this is almost rapid fire now, but like, what are the signs and symptoms for men to wake up and have an awakening to getting some interventions with a provider or someone that can help? We talked about morning erections as a clear marker for not only just, sexual health, it's a clear marker for a lot of health concerns that we should address. But what are some other things people could be aware of that we can put in our resource vault in our community so people understand?
So generally, the things that I target them first because it's things that men tend not to want to talk about. So sexual dysfunction is one of the things men don't tend to bring up as much. So the morning erections we've covered. Erectile dysfunction, big thing, because erectile dysfunction can indicate testosterone issues, but also cardiovascular health issues, which is vital. So any man who notices any form of ED, go and get some blood testing done. See your I don't know, I guess in the US would be different, but we would have like GPs, so it'd be like your family physician, etc.
We know that term too, general practitioner.
Yeah, general practitioners. And then the other one would be libido. So those are the three kind of primary sexual symptoms that we see. The other ones are interesting because they're more vague symptoms and they have cross pathology. So it's, tiredness and fatigue. If you speak to a lot of men, they'll be like, oh, I'm tired, I'm fatigued. But it's, my perspective is that compare yourself to you 2 or 3 years ago. If you feel drained, you can't do things in the day. You're either not sleeping well or you are sleeping well and you're still fatigued. Get it checked. It could be so many things. It could be deficiencies in vitamins and minerals. It could be testosterone deficiency. It could be thyroid dysfunction. There's so many things. So these are things, fatigue, lethargy, energy issues. Then it would come to things like mood disturbances. If you are a man who has been okay with your mood, don't suffer with anxiety, and suddenly you feel that you've started to suffer with depression, anxiety, yes, it could just be depression, anxiety. But if you find that there are a host of symptoms that kind of marry up together that we were discussing today, mood disturbances are linked to testosterone deficiency. So these are things that should awaken you to ask the physician to check these blood tests. And then I guess more from a athletic sports side, a lot of younger guys will come and say, I don't recover as well. I feel like I'm getting injured more. My joints hurt. The kind of vague things where it could be so many reasons. It could just be that you're training wrong. It could be so many things. But again, get your labs done. It's not the end of the world. You know, if these things are happening where you feel your recovery's gone down, you're not performing as well, you know, you're retaining body fat when you weren't previously, you're not gaining muscle when you're training well, and you're eating well. These are all things that would like to me to say, okay, this could be nothing, but it's always worth checking. So
Yeah.
you kind of have the vague symptoms on one side, which you could attribute to so many things. And then you have the more, you know, when they're linked more so with sexual dysfunction and a few other things, this is where the pattern builds. And it's a bit of detective work. So start that process off. If you feel that any of these symptoms flag, get a blood test. It's, you know, I'm a big advocate of metrics. I love to just get numbers done, not excessively, but from time to time, it's worth knowing what.
Well, that I believe that for sure. Like, tests don't guess, right? Because if there is that piece, and there's also some knowledge and just wisdom here about talking about treating holistically everything, because some symptoms correlate downstream to one thing, but most often we're a complex body, mind, and energetics to it. So I even go into those levels of like talking about cortisol, talking about, we just interviewed, we'll be dropping an episode on this new, literally we can test mitochondrial function now. So we can get to these root causes of like gut, mito, hormones, but labs, even if they're not remarkable, like they don't show something, that's actually good information.
Yeah, definitely.
Because so when I do like gut permeability and food sensitivity, if nothing shows up, that's good information. Not just, we have a failure because we didn't see it. It's like, no, now we have more information to choose to go in these other directions if we need to. And it's also a marker for moving in other directions, right?
Yeah, I agree.
So that's cool.
And this is where we need to focus, which is the blood testing. Even if it's normal, it just, if anything, it shows a good sign that one aspect of what we're looking at is okay.
Which is also the conversations I also need and want and continue to have, which is the defining deficiency, normal, and optimal are all very different conversations as it relates to many aspects of health. I use it a lot with clinical nutrition and supplements or using nutraceuticals, because the difference between a vitamin D deficiency, a normal level, and an optimal level are all very clearly different. And so I like talking about optimal when it comes to health and well-being.
Yes.
Let's shift over to the metabolic side, because you've been doing a ton of research on this. You're one of the foremost people reviewing this research and publishing things about this intersection between testosterone and metabolic health.
Yeah.
So talk to people a little bit about, in the audience, about what you're seeing and the correlations, especially because I never thought anyone would know what a glucagon-like peptide 1 would be, but everybody understands the word.
Everyone knows what it is.
So what are you finding, and what should men on these medications actually need to know?
So what I propose, it's not what I propose, it's what I'm looking at is the research that is being done in the field of GLP-1 utilization for the reversal of hypogonadism in a very specific subset. So these are men usually who have metabolic dysfunction. So symptoms of metabolic syndrome. So whether they're obese, they're pre-diabetic, there's the different factors that come into it, truncal obesity, high blood pressure. So these men are a subset of the population who are increasing. So we're seeing it more and more. What they initially thought was they thought GLP-1s will increase testosterone in some men. And they assumed it was because of fat reduction. So body fat percentage reduces. We know that if your body fat percentage reduces, the amount of the hormone, the enzyme aromatase reduces. So you get less conversion to estrogen, and then that stops blocking the pathway and testosterone improves. So this was what they thought was going on. What they've actually realized is that there's a big interplay with visceral fat. Visceral fat produces adipose cytokines, which are cytokines that are hormone disruptors. They basically go into the HPG axis and just cause havoc, and they stop the body from functioning the way it should. And the beauty of what we find is that GLP-1s can almost be like a metabolic reset. So they will go into the system, they will resolve this. Yes, you will get body fat percentage reduction. You will get visceral fat reduction, but you will get reactivation of the HPG axis, which is vital in these men because it stops them requiring testosterone in some cases. And there is a subset group of these patients called what they call late responders. So there are some men in GLP-1s who you commence on GLP-1s and they do not, you find that there's no improvement past the 3-month period of body fat percentage. So they're not losing weight, and then their testosterone levels are static. And in these men, if you introduce TRT synergistically with a GLP-1, they actually they do so much better. Their lean muscle mass increases and all the parameters reverse. So insulin sensitivity increases with the utilization of TRT. So this is fantastic because then you look at it and think we have this subset group of patients that we might be missing the mark on. And GLP-1s play a bigger role than just reduction in weight and obesity. They've got a lot more to play in this system. And interestingly, there have also been control studies done with men who are eugonadal. So if you take a normal man, testosterone is okay, no signs of metabolic dysfunction, you give them GLP-1, no difference. It's not going to suddenly improve their testosterone. So it's not anabolic. So this is where people are saying, oh, does it have an anabolic function? It doesn't have any anabolic function.
Yeah, because it's a
It can do that.
back system for everything, right? Your body knows, and it's going to dump it. And guys, the only way to get out of testosterone is to aromatase it out and goes to estrogen. So if you want to feel like you want man boobs, go for it. Take more estrogen. This is part of the reason why my whole life's path has got me to this place of restoring, not replacing, and how we can do it. So there's technologies available, which we use in our programming to, one, give what the body needs and allow the body to continue to make what it makes. This is the new science that I'm so excited to be able to prove the methods through, because we're starting to see in certain ways, if we can get that testosterone exogenously in quick and out quick, kind of like a mini injection, but tiny, but done not with injections, orally and bypassing first pass in liver metabolism, we're starting to see that the suppression doesn't happen, that the fertility is preserved. And now we're having a different conversation rooted in what we alluded to earlier, which is imagine taking where you were in your 20s and modeling it in your 40s, even though you hadn't got to the place of like hypo, right? And so I'm excited for that, for those reasons. And I also want to point out, and I don't know if you've done this in your research, is we're now, like, I love natural, like there's ways to do everything naturally, but how can there's nutritional support to support the GLP pathways. So I like to hear mechanistically this medication has done this intertwining with, but there's this other side piece that says, well, what if lifestyle medicine can move these two arms too, you know? And so that's where I think a lot of the nutritional world is taking head. They know that GLP-1s are great, but we also know that this medication it's a receptor agonist. So we already know it exists. We're putting on the light switch for it. So there's always these ways underneath that we can build that. But I love that you're doing this research so we can support our left brain, like intellectual knowledge around the science between the interplay of metabolic function and testosterone. Because they're not out of the equation of or, it's and.
See, one of the interesting things that sometimes that flags up is there's a massive interplay between insulin resistance. So we see this quite a lot. And
right. That's where you said visceral fat. I call it hot fat, right? It's all metabolically active in the wrong ways.
Yeah.
And that's why men are very, very, this is where the tired come, like, it's like the chicken egg, right? We know it's there. Yeah. How do we fix it? And what do we do because of it? So, yes.
And the difficult thing is that you'll get patients who will go onto a GLP-1 and they will get improvements. They will. And then, you can't outrun a bad diet or a bad lifestyle. So if you just go back to what you were doing before, you're not going to suddenly miraculously be reset forever. And this is where I always say to patients, this is where the hard work is. When you're on this medication, you're on, for example, TRT, utilize this as basically a chance at a second life to improve every aspect of what you're doing. Whether that be, if you know that you're insulin resistant, there are methods to improve insulin resistance. Optimize your diet, change how you're doing things, implement fasting into your regime in the morning, however it is. Fasted cardio works really well. We'll go through all of these things and I'll say, the lifestyle aspect has to play harmoniously with everything we're doing. Otherwise, you will resolve one aspect of it and then you will just continue once you come off. For example, with testosterone, men tend to stay on it, but with the GLP-1, if you came off it, this is why you hear of patients who just pile the weight back on and within 6 months they're back on the GLP-1 and it's like a yo-yo, they're going back and forth. And ultimately they're just burning off all their lean muscle mass over the years.
Well, and thank you for reinforcing this to people, because I have a lot of pharmacist friends that they're injecting their GLP-1s and then grabbing a slice of pizza, right? It's like there's this thing where it's like, no, the pill for the ill doesn't work here. Yes, it will work, and this is why most people gain the weight back, right? It's not the drug. It's like, oh, I can eat whatever I want now, right? It's like, no, it's you're still putting plastic parts in your body, right? Like, we got to figure that out. And so thank you for continuing to reiterate. I actually don't treat many people anymore unless we have an understanding of lifestyle needs to happen, period. If you have no willingness to understand it and change, it's very little we can accomplish. And you're probably not the right fit for me. And the go pay me doctor for the drug is over there,
Yes. I mean, it's nice because the sense I get from you is that you live this. This is not something you're selling.
All right. Yeah. Nice. So the thing we're talking about really here is one of my good friends and mentors who taught me a metabolic reset program. And I love bringing in things like GLP-1s now. When someone's on a GLP-1, I like to teach them that they don't need it. And we do that through lifestyle and food. Yeah. Food is medicine. It's clear this is. So yes, when you're in well care and you're in wellness, you have to be a product of your product.
Yeah.
I'm in the business of health and vitality. I don't prescribe it, but that's a very different equation, right, Zach? From the sick care model, which is if you're a cardiologist, you don't take all the cardiology medicines you prescribe. But if you're in the space of reversing health sickness, you have to do the work, right? There's no ifs, ands, or buts, period.
Yeah, exactly. The thing is, the way I look at this, I'm very blessed because where I am in the profession I am and within the subset and my mindset, it's great because I learn things daily and then I implement it within my life, because it'd be silly not to. It's as if someone tells you, if you do these things, you will live a healthier life. I'm going to go and tell everybody else. Well, then when you come to see me in clinic, I'll be obese. I won't be active. I'm not going to do anything. And then it doesn't make any sense, because if I know these gems of wisdom, why would I not take it upon myself to do it? This is where it comes to me, which is I say to my patients, everything I tell you, I do. If I'm if I'm monitoring, I don't know, if I've got a CGM, for example, and I've decided I'm going to check my glucose, and I have done this and I figured things out, and I'm like, okay, cool. What I've realized is when I eat certain things, it has this response in my body. And what I find is possibly I might be a bit more insulin resistant. So what I need to do is I need to do these 3-4 things and then check again. And these are things that if I would, for example, do myself, well, why, then I will tell my patients, but I will live it first before I tell everybody else. So yeah, I don't just have, I have a passion for this more so than, just a means of an income or a means of like just my profession. So yeah.
Well, and it's clear in your energy and how you're talking through this. So thank you, because yes, that's it, right? I have this do me first principle as it relates to this. Is like, if I can speak through my own experience, but I can also empathize with people as they go through, because yes, we are clinicians. We do know the science. We talk about protocols and all that fun stuff. But when we're talking about vitality and health and wellness and healing, it's an active participation. And the best way I can say this is I've done it myself. I have experience and I speak through that now.
Yeah.
Like, I'm an Oura ring. I track and measure my sleep. I don't just teach that you should do this and then go home and do the opposite, right? And it's not incongruence, but it's also, that is the major factor when providers like you and me are kind of working on this side of things, is instead of taking away a sickness, we're restoring balance. And we've done it ourselves, and now we feel compelled to help others do the same.
Generally, what I find is majority of clinicians within the longevity space, they tend to have a similar mindset. Generally, they all have, it might be slightly different, their take on things, but they all have a very similar take on their own life. So it's good.
Well, exactly. It's like, here, this is like N equals 1, right? We're all N equals 1 experiments on our own human selves, not because we're trying to be in the lab and prove this. It's like, no, let me show you what I've uncovered through my own experience. Like, cause that's how I teach now. It's like, oh, I've been using Oura ring. This is, since the first generation, and I've seen it grow. And it's like, no, stress has been a big part of my life and the traumas that I've overcome. And so I'm tracking my HRV. I use technologies to help ground me. Like, here's what can help you if it applies to you, right?
Yeah.
I love it.
The beauty of, we should get sponsored by Oura, to be honest. But the beauty of what I've found is, I've told friends about this, which is, even supplementing. So it's been a long time I've been supplementing magnesium. And I was telling one of my friends, and he just didn't believe me. I said, when I have my Oura ring, when I started taking magnesium, I noticed my metrics improved on my sleep score. And he was like, oh, is that not placebo? I was like, no, it's not placebo. It is specific. I was like, you can do it yourself. Get yourself a ring and then reduce your caffeine intake later on in the day.
Oh, it's clear, right? And it's fun.
Clear, yeah.
Yes, this should be like sponsored by Oura podcast today. Wouldn't it be nice? I can't even give people discounts or affiliates. They don't do it, right? But it's okay. No, I think it's what you track and measure will improve. And you can add these into things that we track and measure. I actually use my health coaching platform that we use for our functional side of things. Integrates the health trackers like Oura, Whoop. There's plenty of them. I just love this for the sleep algorithm and the HRV algorithm. Those are my two favorite things, and they do it the best. So I use it. But we can integrate it into my platform so I can actually see someone's progress.
I think, all of these, I guess one of the things that always comes to my mind where I'm a bit more envious of you guys in the States, because your healthcare system is privatized. So the psychology of your patients is different to the psychology of my patients. In the UK, we're very, very privileged. We have a free health service. So people don't pay, they just don't want to pay for anything. So when it comes down to seeing someone like me in the private sector, and you say to them, you need to do this, you need to get this form of, monitoring your sleep, people don't want to do it. It's changing, and it's good that it's changing. But the difficulty we come to is the aspect of having to pay for health, which is just, again, it's privilege in the UK, which is you're diabetic, you don't have to pay for anything. Your medication's covered under certain costs. It's not even through insurance, it's just the National Health Service. So yeah, when it comes to things that aren't covered or treated well, like the longevity side of things, wellness space, these things aren't covered. And then the downside is there are some men who just won't access it. And then the beauty of it is the people who seek it are aware and they're willing to pay to improve their life.
Well,
and this is where the psychology needs to change, where I am, to make it easier for these people to proceed.
Well, I've gone through this a lot here too, and in the United States, it's probably less severe because we have a privatized system. But truthfully, in my experience, especially as a pharmacist who's ran a community pharmacy and billed insurance for many things for many years, is I tell them, but I had a hybrid pharmacy. It's like, you can come here for all your stuff here, but when you're going through my programs and this, this is not covered. And so everybody asks, that's the first thing they ask in this country. They're like, will my insurance pay for that? And then I've learned over time, Zach, I was like, think of it this way. You have car insurance, right? And your car insurance it'll pay when you crash the car and you want to get it fixed. Just like your insurance will pay for you to be sick, but it really doesn't pay for you to be well. Just like your insurance for your car doesn't put oil in the tank. It doesn't wash the car. It doesn't detail. It doesn't make it look pristine. It doesn't restore it if it's old. You have to do that. There's an investment in that. And I feel like that analogy has worked pretty well, but it's still the psychological thing.
That analogy is exactly...
This little card is supposed to pay for everything, when in fact, it only pays for you to be less sick, and it incentivizes the whole system for you to be sick. We're going to go on the other side. So yeah,
I do like that analogy. I'm going to steal that analogy for my patients.
Take it for what it's worth. Take your spin on it from the UK's perspective. Because that is the big piece. And that's what this is why when we have our community, like our community site, it's a paid site. And when you want all the resources, but to me, when someone is willing to invest in themselves as the highest level of investment, right? You said, we do ourselves first, right? I invest a lot of money, time, and resources in my own health and vitality, not just learning, but going and doing it and becoming it, because I know that that's the best value I have. And a lot of times, the last time we've invested in ourselves was probably college, like paying for something like that. So yeah, it is a learning curve, and it is a psychology programming that we need to break through. And hopefully, eventually, we will have you and I and all these other fun people that are bridging this gap. Hopefully, the insurance will start incentivizing that side of things, so we can really get to the root cause of where we're going and out of survival and out of sick care. But here we are.
Yeah. I mean, you want primary prevention. You don't want to wait till something's happened and then try and resolve the issues that have gone on. So health is something that is overlooked a lot by healthy people. And then when it changes, they run to seek health. And you just think, okay, if you've just been wary of it, you don't need to be militant with it, but you just need to have certain things that you put into your day to day that give you a good quality of life.
I love it. If a man was listening right now and thinking like, well, we've talked about like this sounds like me. We've talked about getting the labs, but like, what's the first thing you want them to do? Not the system, not the labs. Like, what's the first honest step?
The first step is to be honest with yourself, which is, I always say to my patients, and I live by this, which is, if I notice symptoms I would always correlate it to, Zach, how were you 2 years ago? How were you 12 months ago? What's changed? Is there something that's different? Has your lifestyle changed? And that's the first thing, which is the recognition that something's not right. This is where people kind of falter. They'll just ignore it, push it under the bed, hide it until it gets to a point where they end up presenting to a clinician. So I always say that if you feel something's not right, go with your gut instinct. Just that is enough, which is something has flagged to you that this is not the life you want to be living, or the symptoms are not in keeping with the quality of life you want. And fine, if it is a part of aging, at the end of the day, we're all going to age. I get that. A 20-year-old and a 60-year-old are different beings. They perform differently, etc. In general, you're not trying to do that. But it's, if you just feel that this is not the best version of you, just ask the questions and look around, seek information. You'll find it.
I love that. It's another beautiful wisdom, and another reason. Like, it all starts with awareness, right? And awareness takes presence. So being able to understand, but also be aware of what's going on is a step, right? And it's a lot of steps we can miss because we're caught up in everything else, and we sort of get like in autopilot in certain ways in our lives. And I love that. I like taking that like snapshot. I do it in all my other spaces in life. And it's a nice thing to do. It's like, hey, where was I a year or two ago? Just in general, in my health, how did I feel? And now where am I? And so that awareness is, I think that's beautiful. Thank you for bringing that to light.
And it's a grounding. I always think it humbles you and it grounds you as well, which is sometimes you look back in whatever aspect of your life, whether it is 2 years ago, you look back 2 years and say, where was I? What stage of my life was I? And then, is it better or worse? And if it's better, be appreciative of the fact that it's better. And if it's worse, then ask the questions, what's changed? These are the things, because sometimes you end up on this kind of roller coaster, just going, one way. And then by the time you realize something's almost not killing you, but you might end up in a career pathway, which is so stressful that you look at it and think, okay, I'm actually not living my best life. And is it then worth it long term? So there's a lot of wisdoms that come with it. And I feel, I've got a lot of wisdom to gain. I'm still learning a lot. And, my 30s, 40s, I hope to pick things up, but I like to keep myself as grounded as I can to know that, one, there is a lot more for me to learn. There are people out there to have conversations with, to almost fill up my knowledge bank so I can learn from these people and then have these interesting conversations.
I love it. It's beautiful. Thank you, by the way. This has all been a really great conversation. We could probably go on for more. I want to start when you develop some of your thesis and your findings, maybe we'll bring you back to support more of the research, because this is, like you said, this is just the beginning. This isn't the end. And I think we're in an exponential curve. Where do people find you? Where do they learn more about what you're doing in the world?
I guess I'm very active on LinkedIn. I post a lot of my things that I'm doing, research, what things that I'm interested in, things that I've found. So LinkedIn seems to be a big place for me. You find me with my name. It's really simple. At some point there will be a website, and I do private consultations and things for people who reach out. It's something that I'm looking into for the next few months.
Well, as it grows, like I said, the seed I plant now with all of our guests that are in alignment with what we're doing is we're building this community to give resources to people. So as you grow, as I grow, we grow together. That's part of my tagline of part of what we do is together we grow. So thank you.
Yeah, fantastic. It's been a fantastic conversation.
It has. And I think we got a lot of awareness out to this. And this is kind of the stacking I'm doing with some of the content, is to bring men's vitality to its awareness and getting people to do things. So Zach, thank you so much for joining us. And I know this was super impactful to me. I learned a lot. So I hope you all learned a lot. And until next time, stay well.